Welcome to another Parenting and Mental Health series. Tonight, we're going to talk a little bit about depression and our kids. I know it's a very depressing topic. As we head into the fall and the winter, we tend to see a little bit of seasonal depression come up, but we also, there's just people aren't outside running around. I want to go over some things related to this. Because parents do ask about it. And I think often with parents, we're just a little bit confused about what's just feeling sad and what's depression. When do we really want to worry about it? So let's understand a little bit more about depression first and foremost. It's normal for kids to feel sad or frustrated at times. We've all been there. We've all been sad. We've all been frustrated. In fact, it's very healthy for kids to experience a myriad of emotions. When we start to worry is when any one emotion seems to be the only one present for multiple weeks. And when we don't see any other type of emotion. So if you see that for your child that sadness is starting to persist for more than 2 weeks, you might see other behaviors emerge, because it might not look exactly like the way depression looks in adults. For kids, depression can manifest a little differently. Your child might start to withdraw. They might be super irritable, which could actually be a sign of depression. You could also see a change in eating, sleeping habits. All things like that are kind of signs to look out for. And what I want to let you know is that this doesn't mean that your child will struggle with mental health the rest of their lives. There are a reported 5% of children and adolescents that have depression. My guess is that it's larger than that because that's who's been diagnosed and actually reported it. Those aren't the kids that aren't diagnosed. So that's a quick little understanding of what childhood or child depression could look like. Again, it won't always look like sadness. It doesn't mean your child necessarily going to break down and cry all the time, or it might look more like withdrawal, irritability, and a change in normal patterns like eating, sleeping, the kids they hang out with, they stop hanging out with friends, they stop doing their homework, things like that. Stop doing the things that they used to enjoy. And it's not attributed to something else. So I think that's really important too. And to make sure that you understand that if they recently lost a grandparent or something happened that was kind of traumatic, and maybe not traumatic for an adult, but think about the things that might feel traumatic to a kid: losing a pet, a friend moving away, not making a team or a squad, or just things like that, having to change schools, moving. There are all these things that could really create sadness in a kid. And that doesn't mean they're depressed. Keep an eye on it, because anytime you go through some big life change, we are going to have an emotional roller coaster. And what you want to just make sure of is if this stuff pops up when you don't have those things, right? So then that's a pretty clear sign that there might be some depression in there. If you have a big life change, it has to keep track of it and allow for things to settle down. So if you just moved, it might take more than a couple weeks to settle down. If your child just changed schools, it might take more than a couple weeks to settle down. So give it more than that 2-week window when you're talking about a massive life change. Okay. So the importance of early intervention. If you suspect something's wrong, and again, try and just be aware. This is a lot of what I do in my own office with patients is I ask them to start to pay attention to their self-talk, their behaviors, the things that they're doing, the feelings that they're feeling. These are the types of things that you can ask your kids early on and just say, like, hey, honey, how are you feeling today? And I really encourage, there's something called the feelings wheel. I use it a lot in my office. Break out a feelings wheel, break out a picture with a lot of different emotions on it, and let your kids pick the ones that feel right. Because even when I have adults in my office, they really struggle saying something more than I'm fine or not so good. That's not really very telling, right? You're not really getting to the heart of really what they're feeling. And the closer you can identify the feelings you're actually feeling, that actually helps you feel better because you get validated. You start to feel understood and seen. So as far as early intervention goes, don't wait. Um, you and what I mean by don't wait is be an active parent, right? And then be really aware, ask open-ended questions, don't harp, but pay attention, notice things, and just keep track. Um, you can even ask kids, on a scale of 1 to 10, 10 being king or queen of the world, how are you feeling today? And just ask them for a couple weeks. They're going to be like, why are you doing this? You could just say, hey, I'm doing my own like internal study and I'm just curious. You can make something, or you can just say like, I just want to keep track of how our family's doing. Whatever it is, you can do that. You can keep track of that. And then that can help get a better understanding of what's going on. And then back to that 2 week kind of window, then you can start to maybe explore the fact that you might need to seek something more like professional help. Even taking your kid to a primary care physician can be super helpful. They can, get you started on the right track. So we talked about earlier what it could look like. Being really attentive to these changes that your child might be having are going to be important for that early intervention. I often hear from parents, and this is parents that have had traumatic, unfortunate things happen with their children, or they just finally realize something's going on with their kids. And what I hear from parents a lot is, gosh, I didn't even see it, or I didn't even know what was going on. Okay, take a deep breath. As parents, we're going to miss stuff. We are so close to it that we are going to not notice certain things. There's the example of the boiling frog, which I know is a horrible example, but when you're really close to something and things change gradually, you might not notice it. I have had colleagues who are in this profession that didn't notice that their spouse or their sibling was dealing with mental health challenges until it got really, really severe. So don't worry, we all miss things. So have some self-compassion first. The best thing we can do as parents is to ask open-ended questions, to be available to allow our kids to talk without giving advice. Just listen. So some things to look for while you're heightening your awareness, right? Be attentive again to things like academic decline or the academic decline, or maybe a lack of motivation, increased fatigue, again, not attributed to other things. Right now, I feel like in this area, there is pneumonia going around the schools. So kids are sick, they're not feeling good, and pneumonia lasts for a while. So your kid might feel fatigued for weeks. It's a little different than the flu. So, ask your child, which can be really tough. And I know sometimes people feel like they don't want to ask because they don't want to put ideas in their child's head. Don't worry, the ideas are already there. So, and what I mean by don't worry is like, you're not going to put an idea there. If a kid's really happy and you say, hey, have you ever thought about harming yourself? They're not going to say yes. Or they might say, yeah, there was this one time. And then they're going to show you how they got out of it. Right. But if a kid's really struggling with that type of stuff, they're going to say, they might admit it, they might not, they might avoid it, but that's also very telling. So ask questions. If your child admits that they have thought about harming themselves or suicide, that is an immediate get help. I will tell you, yes, calling a therapist is usually not going to be, it's not like going to the emergency room. You're not necessarily going to see someone right away. You can get that set up. And in the meantime, call things like 988, which is a helpline that is available 24/7. There are helplines available 24/7 that you can reach out to at any time. There are also, if you struggle getting in with a live therapist, or of course, Bay Community has therapists, and we are accepting new people. So you can always set up an appointment. Just know that that will probably take a week or two to get in. So you can also look at things like BetterHelp, things like that. There are other online services that you can get an app for, and you might not see the same therapist every time, but you can access them much more quickly. For older kids, like high school and college age kids, sometimes they really like that because they can just hop on their phone, hop on the app, schedule with someone within 24 hours, and that feels good to them. They're getting to talk to someone. It doesn't need to be the same person. And sometimes that feels better to them because there's some level of privacy that they feel like they have, that they're keeping their stuff to themselves. Anyway, point being is there are multiple options and you can use them. You can even go to the emergency room if it feels really bad, or get a sick visit to your primary care physician. Most physicians will see a child same day. If your child is experiencing this, you can get a sick visit. Okay, just get in there, get a sick visit so that you are getting your child seen by a professional. They will likely recommend some other type of behavioral health treatment, but that is better than waiting a couple weeks. Okay, so that's in an emergency. On the day-to-day, things to look for, right? Again, persistent sadness or irritability or withdrawal for more than 2 weeks. This can include or also look for things like a loss in interest in activities that they once enjoyed. This can be like a kid that loves video games but doesn't play them anymore, or a kid that used to love to go outside that's sitting inside staring at a screen. Again, change in eating or sleeping habits, low energy or difficult concentrating. Depression often comes with that, which in adults is often a struggle because they will struggle concentrating and they think, oh, maybe I have adult ADD or ADHD. And we have to really rule out things like depression and anxiety, which can cause a lack of ability to concentrate. Feelings of hopelessness or worthlessness. So if you hear your kids say, I don't know, why should I even bother? Or nobody cares anyway, kind of listening for things like that can be helpful. And then when they ask things or they say things like that, say, what do you mean no one cares? Like you can ask like, I want to know more about what do you mean no one cares? Well, no one cares what I look like. And then you can listen, ask open-ended questions. And if you do eventually challenge, but like, wait a minute, I do care. I care about you. They might roll their eyes at you. It's still important to tell them, right? So you can confront some of the things they're thinking. Just time it. Allow them to get it out first. Allow them to feel heard. Okay, so what can be some causes? Well, it can be all over the place. Causes, like I said before, can come from like very traumatic events, big life changes. It doesn't have to come from a single cause. So remember, it doesn't have to come from a single. It could be a combined set of things. Some families have a history of depression and mental illness, so that might make you or your child a little more predisposed to developing these types of things. And my word of caution there is your family might have a history of it because of environmental factors that have persisted in multiple generations. And it might not actually be genetic, but it can be. So it could be from all these different things, and they all can contribute. What I've seen most often is it's rarely a one factor thing. It's several things that build up over time. So maybe your child, you move to a new location. So your child goes to a new school, they're struggling making friends. Maybe they don't get onto a team or a squad or a troop that they really wanted to be a part of. Maybe they don't get along with one of the teachers. All this stuff building up can start to show signs of the depression. Again, I get nothing from Pixar, but I highly recommend Inside Out 2. This is looking a lot at adolescence, and it does a really good job of kind of showing this gradual shift of a lot of things changing that can build up to making kids feel anxious, depressed, etc. And it manifests in some really funny ways that Inside Out 2 does a really good job of showing. So what can help? I've talked a lot about just being a supportive parent, and that's so true. Quality time is better than just lots of time. So if you're around, your kids, 5 minutes of really paying attention and really listening is way better than 40 minutes of you two just sitting in the same room staring at your phones. As far as quality time related to professional help, there are a lot of different ways that professionals can go about helping kids with depression. What we've seen work really well are things like cognitive behavioral therapy. My caveat to cognitive behavioral therapy is yes, cognitive behavioral therapy can be highly effective. Okay. And it's one of the most studied therapeutic approaches because you can gather metrics or data on it. Things like talk therapy are a lot harder to gather metrics or data on. And so therefore it's harder to prove that it works or doesn't work. Cognitive behavioral therapy has a lot of data that supports it. So we often see that associated with things that work. Other things that work, interpersonal therapy or family systems. If you see someone that specializes in interpersonal therapy or family systems, that can be really important. What I like about that approach, especially for kids and adolescents, is oftentimes with that type of therapy, you're working in learning social skills and social cues that then help kids develop a better emotional intelligence, which helps them navigate difficult things better. Because remember, our kids are developing a sense of self, and depending on what developmental stage they're in, they are pulling away their sense of self from their parents. They're trying to identify who they are based on their peers or, based on their role models. And if they feel like they don't fit in or they're letting somebody down, that's going to cause a lack of confidence, which can also lead to some of this other stuff. So when they learn social cues that help them to fit in, that help them to feel a strong sense of self while being around people that are like them and also different, that's really going to help them navigate all this better and can become a really good kind of protective factor with kids going forward and make them more resilient. DBT or dialectical behavioral therapy is a great one. This one's used a lot in residential. This would be like places that folks would go maybe after having a hospital visit of some really extreme mental health challenge. And then they go to a residential facility for a while. No, not a psych ward. We're talking about more like homes or places where it's kind of a transition between the hospital and home. DBT is used a lot in these places. So why I tell you that is because these are places that focus really on really some tough mental health challenges. And they use things like CBT and DBT to help because it works. DBT focuses a lot on emotional awareness, where cognitive behavioral therapy focuses on your thoughts, right? Your thoughts and how they affect your behavior. DBT is focused a little bit more in on the emotions, being aware of your emotions, being able to handle them. So instead of something I tell folks often is our emotions aren't really something we control. They happen. Again, I go to Inside Out, the movie's Inside Out, because those emotions that we see, the characters in the movie, they're doing their thing regardless of what the person is doing, right? And that's kind of true. Emotions are chemical reactions, and they're triggered by all those things we talked about before, right? Different environmental factors, maybe stress, paired with genetics that can cause, chemical shifts, and that will create emotions. And so the emotions are our body's way of kind of communicating with us, like, hey, we want to do more of this, or hey, we never want to do this again. This is awful. And everything in between. Or hey, this really reminds us of something that happened in the past that we really didn't like or really did like. We're going to feel emotions. What's important is how we react to them. And because all this happens in milliseconds often, we don't separate the two. But that's what DBT does a really good job of, is helping folks be aware of their emotions. And what we say is like regulate, because what we're doing is we recognize we feel anger, but instead of just bursting out in flames and anger and reacting what would end up being a poor reaction, we can feel it, see it for what it is, and what would look like regulation, right? We hear it, we feel it, and then we do something different with it. So DBT does a really good job of that. So if you find someone that works with that, it can be really helpful. And I say also with this, that different kids respond to different types of therapies differently. So I'll talk about that in a second, but it's crucial to find someone that can tailor their strategies to what your child really needs. So if you get on the internet and you see, oh, this is the type of therapy that might really work, just remember that that is one person's opinion. If it's research, then they're looking at a subset of people, so a little more valid, but oftentimes we are talking about therapies that work for, the bell curve, the majority of people. That doesn't mean it works for everyone. And that's okay. We want to find therapists that will alter and shift or say, like, you know what, the type of therapy I do really isn't working for your child. I suggest this group, right? It all depends on your kid and finding someone that can really work with it. So all of this is all support. I go back to that what we were talking about in the beginning. As a parent, it's really, really super important that you show support. All kids, depressed, happy, sad, all of it. And us, we all thrive when we feel supported. And parents are vital to that for kids. So ways to show support: listening, just being there, right? We talk a lot without saying a word. So just being around, even if the kids don't show that they're appreciative or grateful in the moment, you being there is helpful and it shows support. Showing up to different activities is showing support. So a really important part of a kid getting through depression or getting over it is not throwing a therapist at them or getting them medicated and then going about your day. It's supporting them and getting them the help they need and trying also as a parent to start to understand these things. Listen to what the therapists have to say to you. I spend a lot of time with parents because kids, we're part of the environment. So this doesn't happen to kids in a vacuum. So oftentimes I have to talk about parents changing the way they speak to their children or changing the environment slightly, which might feel tough, but can make the environment more supportive. I've been there. I have often had to change the way I speak or the way I do things in order to recognize that that is being more supportive to my children. And that ultimately, that support will help your child more long-term. So I already talked about a few of these, but some quick tips for parents. What does support look like? Well, showing empathy and compassion, right? Avoiding criticism and judgment as much as possible. That will help your child feel like they can trust coming to you about tough stuff. Validating their emotions, that can be as simple as, hey, you seem really frustrated today. Or I can tell you're really sad. I've been sad too. And sometimes it feels like it's never going to end. Would you like to talk about it? Right. So sometimes, even though we know what's best for our kids, or we have an idea of a way for them to get out of it, we have to step back and just listen and let them express what they need to express. And then ask them, well, hey, do you want to try something new? Or are you open to this or that? That can then help prepare them to hear what you might have to say. Okay. I talk about failing safely all the time. If your kids are struggling with something in particular, whether it's a sport or social settings or academics, give them a chance to practice things safely, maybe role play with them or walk them through something. Or if you're the wrong person because they feel very judged by you or whatever, find someone that they can practice with. Those chances to engage without feeling like they're going to be judged or criticized is going to be so important to them gaining confidence for the future. Also, I'm not talking about toxic positivity. You don't need to go over the top. I have a few patients that I work with that just kind of talk about like, hey, I'm just not this super joyful energetic person. So when I try it, it feels really fake. That can be true, especially if you live in a world, people that assess threat for a living or look for dangers or, are in some sort of protective role. You're designed daily and you are constantly practicing looking for the bad. So it can feel really disingenuous to look for the good. However, don't think of it so much as being inauthentic as much as it is retraining your brain. It's as comfortable as it was learning how to ride a bike for the first time, or as uncomfortable as it is trying to write with your non-dominant hand. It doesn't mean it's wrong. It just means you haven't practiced it. So practice accentuating the positive. It doesn't have to be over the top. It can be as simple as like, wow, the leaves are really pretty this year. For the fall, or hey, your hair looks really cute today. Something really simple, right? It doesn't have to be something massive. It can be something really little. The other criticism I get on this one, or the resistance I should say I get on this one, is like, well, I shouldn't be thanked for doing something I'm supposed to, or I shouldn't thank my kid for doing something they're supposed to do. Maybe. I equate that to everyone wants to feel seen and everyone wants to feel appreciated. So whether you're supposed to do something or not, uh, appreciating someone or having gratitude for someone doing what they're supposed to is not such a bad thing. Think about how many times in life people aren't doing what they're supposed to. And so I'm always grateful when someone does what they're supposed to, because I see people not doing what they're supposed to all the time. When my kids put the dishes straight in the dishwasher, I'm thrilled. I thank them. And my kids have said, well, that's what we're supposed to. I'm like, I know, and I'm super grateful you're doing what you're supposed to. So those are the types of things that you can really give feedback. Now, sometimes the kids are going to resist. Like if you see them play really well on a sports field, this has happened with me before, where I've told my kids, hey, you did really well today. Like, oh, I don't feel like I did. Okay, then be more specific. There was a specific play or something you saw them do, and not just about doing something well, but like, hey, I know you used to struggle with this move or this technique, and I saw you try it today, and I'm really proud that you tried it during a game, right? Whether it worked or not, it doesn't matter. You want to encourage them to try things and notice when they do try things that they're being a little risky, right? They're trying something that may or may not work. That's great. When you see your kid be nice or kind to someone when they don't have to be, great one, right? Okay, so a little bit back to the therapy. I probably should have put this slide a little bit earlier, but some kids will resist therapy initially. And the most important thing is just to say, hey, let's just try it. I do this a lot with other like extracurricular activities or things with my kids, like, let's try it and give it a period of time. Now, therapy, don't say one session, because this isn't a magic pill. One session is not going to work. It might feel helpful. Some people leave the first session like, gosh, I felt so much better after I talked to you, or after I talked to my therapist. Yes, and the problem is still there. It takes time to work through it. It is not going to happen overnight. So say, hey, let's try this for 2 or 3 months. And if you really feel like you're getting nowhere, then we can shift. And all the while, talk to the therapist. Say like, hey, they came home and they didn't feel like this worked. And say that and with your child in the room, because that can help them learn to advocate for themselves, right? So if they go to a school counselor and they say like, well, yeah, I went to go talk to the school psychologist, then they told me to do this and it didn't work. Okay, that's good feedback for the school psychologist. Like, go back, talk to them, help your kids advocate for your kids and help them advocate for themselves. Okay, so now you've tried different options. They've tested it out for a little bit and still feels like it's not working. That is okay. Sometimes, and I tell my patients this all the time, that we're both human and sometimes people just don't click. And that's okay. And as a therapist, I'm not going to get offended by that. I get it. Not everyone's going to love me. And I've gotten very used to that. And that's okay. My ethical responsibility as a therapist is to make sure that the people that come see me get the care that they need, which means if I feel like I'm not the right person, and it might be because of me, you might remind me of something that's something tough in my past. And so I feel like I have what we call a lot of transference going on, or countertransference. If that's coming up, it's my ethical responsibility to bring it up and to say, hey, I really think I have someone I think you should see that I think you would work with better. That is okay. So that can happen, right? It's just mismatched. Other things that could be happening, I say this to people when they're going to therapy, make sure that the therapist kind of talk about a plan. And if they haven't talked about a plan, ask them for a plan. Therapists should be asking what your goal as a parent and what your child's goals are for therapy. If it's like, I don't want to feel this sadness all the time anymore, that can be a goal, that's fine. But you want to have a goal so that then the therapist can create a plan and adherence to the plan. The nice thing about things like cognitive behavioral therapy and DBT, they're very structured. And so they often have a plan that's associated with them. If the therapist never talks to the parent, that can also be somewhat troubling. Now, they're not going to bring you in every session, or, most therapists will not do that. However, there should be some open dialogue. They're also not going to tell you what your kids are talking about because that would break their trust. However, it's good to have dialogue with the therapist, say like, hey, what can I do at home to support what you're working on in this room? Or, things like that. I know some families that will alternate. The child will see the therapist and then the parents will come in the following week and then the child will see, and then there's a group session. Things like that can be really helpful if everyone feels like that everyone can honor each other's trust and boundaries. So something like that can be good. And also that can be something to look for within the therapist or the professional. Something else that's really important, and I've talked about this a few times in the past week, and certainly with the holidays coming up, I mean, we have Halloween, Thanksgiving, Christmas, New Year's, lots of stuff coming up. Kwanzaa, Diwali, lots of Hanukkah, lots of holidays in this part of the year. So because of that, it's essential that you take care of yourself. If you are not feeling good, you are not going to be your best self for anyone else. So make sure you're teaching your kid that it's important for them to take care of themselves. And I think we want our kids to know that, right? So make sure that you're doing things to take care of yourself that charge your battery. Make sure that you're seeking the support that you need and asking for support and help when you need it. Make sure that you're scheduling time for yourself because you need to be well so that your kids can be well. Well, I hope you enjoyed that session. I hope it was helpful. If you have more questions about depression and kids or what that looks like, or you have a topic, please post it and we'll be happy to get to it. Have a great day, evening, and I'll see you again next week. Have a good one.